for our instruction course. This will be purely a non-academic session where we share our experience and life lessons, and may this serve as an inspiration for all. So I invite our first speaker, Dr. Lekha ma'am, who is a consultant medical retina and cataract surgeon at Giridhara Institute, Cochin. Over to you, Lekha ma'am.
Good afternoon to all of you, and thank you, Dr. Divya, for giving me this very different experience. So, this most unplanned and a very ordinary journey started with something called as blessing, which was my entry into Shankaranetralaya for DNB training. And the intensive and excellent 3 years of training that followed taught me what it really means by comprehensive eye care. But that was also a period which molded not only the clinician in me, but also the person. And eventually, it was also the beginning of my medical retina career, which was offered to me by our chief, late Dr. S.S. Badrinath. So as I said, retina was actually not completely my choice. It was one of the options. In fact, it was more offered to me. The reason because I had fear, because of the vastness of the subject and also the low confidence level I had at that time. I'm sure some of the beginners also must be going through the same phase. But slowly, I could improve with the guidance of my excellent teachers and the support of my seniors and friends. So at Shankaranetralaya, the main stress was learning proper clinical evaluation, especially doing good indirect ophthalmoscopy with scleral depression. And I would say anybody planning to pursue retina, this is the first thing that you should master. And you should also learn good documentation, because only when you document your lesions, you are understanding it in all its dimensions. We were also taught optimal use of investigations, which is integral to any retina practice. The main modality at that time was laser, but I also learned very valuable lessons in dealing with patients and managing their expectations. After that, I had opportunity to work in various situations, and I am sharing that so that at least some of you in similar setup can sort of relate to it. So it started off at Shankaranetralaya, where I was part of an expert team. I had help for everything. Learning curve was very fast, and I'm telling you, to those in such institution, utilize all the facilities you are getting there, because you may not easily get it outside, but be prepared for a rigorous schedule. Then I had to move on to a corporate hospital where it was like a solo performance. The main part of that is you do your decision making all yourself, and slowly you will become a kind of posterior segment specialist, because everything behind the lens is sent to you. So your experience in uvea, neuro-ophthalmology, everything improves. I also had an opportunity to work in a charity hospital that was mainly to improve my cataract surgical skills. And I would say this combination of cataract with medical retina is something which can enable you to adapt into any kind of small to medium scale setups. And if you have if you are interested in teaching, another option would be to work in a medical college or in a multi-speciality hospital with training programs. And here, another advantage is the interaction you get to with the specialists of the other departments. And for me, during that period, I was comparatively getting more spare time, which I utilized it for publications, and that helped me to keep motivated. So after all this, now at Giridhara Institute, since the last few years, I am extremely happy, because to me, it is an extension of Shankaranetralaya, and I feel my life has come a full circle. Here, I am getting an excellent mix of good quality retina practice, good infrastructure, a motivated team to work with, and opportunities for continuous learning, and above all, an encouraging and supporting team leader in Dr. Giridhar. So as I look back, it has been a paradigm shift in retina practice. What started off with very limited investigations and laser as a main modality of treatment in the early 90s was revolutionized with the advent of OCT and anti-VEGF injections. And I would say this is the main thing that has made medical retina practice much more fascinating and enjoyable. And this can really be divided into pre and post anti-VEGF era, and that has made all the difference in medical retina. This was followed by a proliferation of many new imaging systems, so that we are seeing retina in much more precision and detail, not only newer anti-VEGFs, but also many changes in lasers and even technological advances like artificial intelligence. And as we survive the pandemic and move on, we can see the invasion of online platforms in every aspect. More anti-VEGFs are continuing to come, and we are understanding the importance of genetics, and very soon we may have treatment for many so-called untreatable diseases, including inherited retinal disorders. So the landscape of medical retina is really changing with all the advances that is happening, especially in the field of imaging. We have a more deeper understanding of many retinal diseases. Newer diseases are getting described. We have more precise treatment strategies, and next game changer could very well be the gene therapy. So all this has created an increasing demand. As we all know, the diabetics are increasing, also aging population on one side and more preterms on the other side. We have more imaging modalities, so we need more trained manpower, and also the increased workload because of the frequent treatment that we need to do. For this, we also have to increase the supply, and as practicing retina specialist, I feel it is our responsibility to motivate and train the youngsters, and these are the fellowship opportunities available at Giridhar, and for opportunities elsewhere you can refer to any edition of IJO. It's important that you have some of these attributes as you pursue your career, most important being an interest or passion for the field you're working in, focused, hardworking, dedicated. You should have patience because most of our patients require lifelong care, unlike cataract, which is a one-time intervention. You need to adapt to circumstances because retina is a specialty which needs a lot of infrastructure, and the place where you're working may or may not have it, but utilize whatever is available. Have good communication skills to establish rapport with your patients, and my philosophy has been cure if possible, otherwise at least care for your patients. Compete, but with yourself. Never compare with your surgical colleagues because their work is at a different level. Instead, be a team player. Have your monetary priorities clear and have a positive work-life balance. So these are some of the views of my colleagues in the same field but in different setups. So this person had a fascination for retina and decided to pursue it. There's another friend after the retina, she's working in a predominant cataract setup, but she feels she says that she can do a lot of help to her colleagues for pre and post-op evaluation, her ROP work, all that. She is very confident, and there's a budding specialist who says believe and be kind. So as my journey continues, I'm immensely grateful, and I think it was a privilege to take care of babies from few hundred grams to those in 80 plus, 90 plus, and I look forward to a lot of hope. And I'll continue to understand the dream of this great visionary and will continue my efforts to carry his legacy forward. So this is my message to all the youngsters. The path from dreams to success does exist. May you have the vision to find it, the courage to get onto it, and the perseverance to follow it. Thank you.
Thank you, ma'am, for sharing your life experience. So, thank you, ma'am.
Now let me welcome Dr. Divya Alex to deliver her talk on From Pixels to Precision, a young VR surgeon's path to mastery.
A warm good evening to one and all. I thank KSOS and Scientific Committee for giving me this opportunity. So this journey is entirely based on this presentation is entirely based on my journey. So I just want to say everyone have a different modus of operandi to the success in their career. So these are just few thoughts that I thought that made a change in mine. So my interest in retina started with during my early MBBS years. I just started my second year, and one day, one fine morning, I woke up with floaters in my eyes. I didn't even had the clinical cue to understand what a floater was. I gave a visit to my OPD, and I still remember the panic on my professor's face. The PGs were rushing to see my dilated fundus examination, and I was diagnosed to have vitreous hemorrhage with lattice with breaks. And I was immediately referred to Giridhar Institute, Cochin. I studied at Calicut Medical College. So I traveled 200 kilometers all the way to see a retina doctor. I didn't understand why. And I had very luck to meet Professor Dr. Giridhar. And within seconds of examination, he just told she is too young to have a detachment. Just an observation with follow-up will be more than enough. His confidence and calm demeanor let me thunderstruck. But at that moment, I understood retina is something unique. No matter what, I want to be a retina surgeon one day. And years after, here I am very proud to say I did my fellowship from the very same institute. So the point is that do not pursue a fellowship just because it is the norm. Everyone is taking a fellowship, so I should also take a fellowship. It should never be like that. Pursue a fellowship that resonates with your ambition. And secure a fellowship at one of India's top institute. The matter is not just about prestige or privilege. These institutions offer an ecosystem where every interaction, whether it be your professors, peers, theater staff, nursing staff, everyone will impart you valuable lessons that you cannot get anywhere else. And make sure that you get adequate hands-on training during your fellowship, because this is a pivotal transition phase from theory to practice. And just like the parental guidance during your early reformative years, you need strong mentors throughout your fellowship, and all through your career, you need the strong mentors. And a fellowship provides equal opportunities to all. The difference lies in the commitment that you bring to the table. I won't lie to you, Retina Fellowship, it is not for a faint-hearted person. It requires enormous amount of dedication, hard work, and focus. For me, the personal journey was nothing short of grueling. I had a 1-year baby to take care of, and you are in the late 20s, always financial constraints will be there. Guilt will be creeping in every day. So I had so much guilt crept in. So I thought, why don't I deviate something into fruitful outcome? So during this period, do some meaningful research, publish in esteemed journals, bag as many exams as you can, and do the specialized techniques such as ROP, and present in state, national, and international conferences as many as you can, because you just have got 2 years in your hand. And always remember, the institution does not need you as much as you need it. And after the fellowship, dedicate a year or 2 as a consultant in the parent institute if they allow you to. And this is the era where you learn the mistakes, learn what not to do. It is very important in retina, which cases not to touch. Assist and do some complex cases. So this year will be a cornerstone in your experience. And being in the shadow of the parent reputed institute is always a safe choice. But for anyone who want to embrace growth and independence, bring out from the comfort zone, establish your own practice, it is a challenge, but it is a lifetime opportunity. I was offered to start a retina unit in a chain of hospital where hardly anyone knew the spelling of vitreoretina. Starting from scratch wasn't easy. For example, in an institute, if you see a patient with diabetic macular edema and you advised anti-VEGF, you see the patient next for the follow-up. So what happened in between is never your headache, but a one-man show. Everything, every minute detail is your responsibility. So beginning from financial, the counseling, the equipment, sterilization, everything will be your responsibility. So you have to train a team. So till the training period over, it's going to be a Herculean task. So I went to my parent institute, I went to the all non-academic session and learned how to build my dream come true. So retina, it's always about a collaborated team effort. So you need a dedicated team, and this dedicated team, and believe me, you should be excellent friends with an phacosurgeon, and hand in hand you need several specialists you are in talking terms to. So it has been now a 3 years of journey. And now as a team leader, I am very proud to say I have a very good dedicated team under me. And as a team leader, I have to be arrogant at the right place. I have to show attitude at the right place. But you should take care of your team. They will have hundreds of problems, and you should be the pillar of support for them when they need you. And after building a team, the main question was, in an established city like Cochin, why would a patient choose you over others? Because there are already many reputed hospitals, and nobody even know like some retina surgeon is exist in this hospital. So my hospital had 23 branches all over Kerala. So what I did was, I chose 7 centers to work with where there was huge inflow of patients. I started medical retina practice in all of these departments and pooled the surgical cases to my main center, the Ernakulam. So slowly, by this method and by local reference, I grew my practice. So getting a job alone is never sufficient. Use your brain and market yourself and make sure that you do a good job. And one other thing, especially you are in retina practice, even if it is retina or whatever else, you master the art of communication. So because in retina, the outcomes are never perfect. At times, it's not like it's never perfect, but at times it cannot be perfect. And I will show you a funny video to just enhance it. It's a very small video.
P4 मुझे कुछ दिखाई नहीं दे रहा.
आओ बैठो पढ़ो.
X P4 Q.
अब पढ़ो. कॉन्ग्रेचुलेशन, आपकी आंखें तो बिल्कुल ठीक है.
शाबाश. Thank you.
Jokes apart, we have to deal situations like this. So master the art of conversation. You have to build a trust with your patients, especially in this era of EMR. You forget to look at the patient's face and you just start typing whatever they tell. It should not be like that. Explain to the patient what they can expect out of this retina treatment, and make sure that before the surgery day or before the surgery, you sit with the patient and the bystander and gives them some moment to talk with you and make them understand that your doctor is also along with you. And next very important point is that it is an increasingly competitive field and it's very easy to get tempted. For example, the market is sprouting with new biosimilars every now and then. We don't even know the company name. So one offer was like, please support our company. We will give you an international trip. So it's very easy to get tempted. So remember that your reputation is your greatest asset. So I always tell them, if my professors give you a green tick, I will also give you a green tick, because in your early career you cannot play with your reputation. And during very recently we had seen one unfortunate incident, like in one oncology doctor in Chennai had stabbed by a patient's son. It was just because of a statement made by another doctor, your mother was not treated properly before. This is what is called as medical jousting. This we should never do, because in retina the patient comes for second opinion, even to fifth opinion, they may come and go around. One patient has just come to me to ask whether some doctor was good at his surgery. He didn't even want me to exam. He just wanted to know this. So maintain professional integrity at any cost. And retina is a field of constant evolution. So you always have to commit to continuous learning. So the best way to learn is to teach others. So being a consultant also, I managed to present at national and international conferences, present some paper, and wherever a podium is available, I make sure to teach. And last but not the least, like being a retina surgeon and getting lakhs of income, it is never enough in this situation, because India's inflation, it is skyrocketing at the rate of 6.2. So whoever doesn't know what inflation is, I will just give you an example. 5 years before, with rupees 500, I could get a sack of vegetables. But today, I won't even get a cover of vegetables. This is as simple explaining inflation. So if you have 1 crore right now, after 10 years, it will be just half the value. After 20 years, it will be just 1/3 the value. So be a smart investor and always balance your life and career. And stay fit and stay healthy. Only a happy doctor can create happy patient. So I at least try to remain healthy by playing badminton with a professional coach. And I love to travel and I love to cook. So all I have to tell is that believe in yourself. If you believe you can, you can. If you believe you cannot, you will never. It's all about mindset. Thank you so much. And hereby I invite Dr. Divya Balakrishnan ma'am, the Iron Lady of Retina. I want to hear like how to proceed from my this stage to her stage. Over to you, Divya ma'am.
Thank you, Divya, for that wonderful, comprehensive talk. And I think it might be an inspiring one for anyone who wants to take any surgical specialty as such, like not just VR.
Thank you, ma'am.
So thank you, Divya. As Dr. Lekha was mentioning, till now it was very easy to make presentation because that was just scientific medical talks. So this was a bit different and I did not know actually how to go about it. So I'll try to see like, so the topic was like a woman's path in VR surgery. So when I looked at it, it has two aspects. One is being a woman and second is a surgical specialty. So when I thought like, is being a woman a barrier in surgical field? Yeah, maybe decades before. So because, so who you see here is my mentor at LVPI, especially in pediatric retinal surgery, Dr. Subhadra Jalali. And to my right is my HOD at Little Flower Hospital, Dr. Elizabeth Joseph. So when I spoke with Dr. Subhadra, ma'am used to say that when she initially wanted to join for fellowship, they were hesitant to take her because being a female, after some time she will become pregnant, she will have kids, then kids will fall sick, so she will have to take leave. So they felt that it will be very difficult for a female to pursue a surgical fellowship. So, but then she stood against all these odds and she proved herself that being a female is not a barrier. And to my right, so in that photo right, it is Dr. Elizabeth. So she did not have any problem in getting into Little Flower Hospital. But what she said was, initially when patients came, they used to have two consultants in a room and one used to be a male doctor and second used to be her. So when patients come in the queue, they will have a tendency to jump to the queue where the male doctor was sitting. So they had a hesitation. The patients used to have a hesitation to consult a female doctor, especially if a surgeon. So these things were there earlier. But I think as of now, does this barrier exist now? It has really come down. So I don't think any institute now would not give you a fellowship or a surgical branch just because you're a female. And even our patients, we know, many of us, in fact, we know like in many of the fellowships now, 90% are females. So I think the male gender has come down in especially ophthalmology. So I don't think this barrier is there, not much. So I was looking at, is there is any literature to look to see like what is this problem with this female gender and surgical field and all. So I came across this one of the article where they looked at the residents or the surgical residents and whether what is that factor which determines that. So when they looked at these residents and took the feedback, it was seen that whenever they came across a female doctor as a role model in their training, then they would tend to make or choose a surgical career as their choice. So they did have some influence on the person, especially if the same gender. So now I should say that because many of us are like female ophthalmologists, so all the junior residents, even if you see in our hospital, it's only 2 of them are ophthalmology residents are male. The rest are all females. So I don't think that barrier also should come now. And this was again another study which looked at what is the factor which influenced the choice of surgery as a career by pre-registration interns. So there they saw that the factors were like, one was male gender. So if the candidate is a male, they tend to go for more of surgical field. And especially if the person is single and not married, then their tendency to go for a surgical field was higher. And again, if they had a role model in their life, like their parents or their teacher or someone who had influenced as a surgeon, then the chance of them to go for a surgical field was very high. But many of them showed that the barrier being a woman was because especially when it's time to join for a fellowship, that is the time then they plan for a family, they get married. So the difficulty in balancing career with this domestic responsibilities is a main factor which many of them actually tend not to go for it. So in our education system or the training program, it should be in such a way that the system should accommodate or take care of this spirit, and not only the education system but the family support. So this many a times women herself or themselves think that every responsibility of the kid and the entire family is on our shoulders. And as a disclaimer, I should say that I may not be a right person to say this because I belong to the category of single. And overwhelming lack of female role models in the surgical field is another thing. And second, another factor which mainly comes is it's more stressful. Rather than dealing with a medical, when you deal with a surgical, you have to plan, then you are worried about if anything goes wrong with the patient. So you have to be like kind of stick with that patient, stuck to the patient, and the stress is little more than when you deal with a medical scenario. So these things are few things which might be like little challenging for a woman, but I think I should say that it's all our mindset. So if you think that you can do it, and like Divya was mentioning, if our ambition is like to become a surgeon, then none of these should matter. So why I became a surgeon? So I never felt, when this topic was given to me, it never occurred to my mind that I cannot do something because I am a woman, except for maybe some physical task. But because I was brought up in such a way that I was never restricted that you should not do this because you are a girl. I was never brought up like that. I should thank my parents for that. So this is my father and mother. And then I realized that it's basically our mindset, how you are brought up. So if still anyone feels that being a woman is a barrier, it should start from us. In the sense, like when you bring up your children, they should not be brought up like, you do this because you are a male or you are a boy, you do this because you are a girl. It should not be that way. You should give equal responsibility, and they should have a taste of both the household and the managerial task, so that they should know how to manage both the things. So when they become adult, they should know that it is not one person's responsibility, so that women get more freedom to do what they want. That is what I feel. I don't know what others take on this. So again, this was another study which looked at the subspecialty training. So when I talk about VR, the studies have shown that VR is one of the most sought after specialty. And in that, again, when you looked at the ratio, it is mostly male. Maybe because what I feel is that why not many females come to VR surgery? First thing is that, as I mentioned, it is our exposure during our training period. So many of the institute, actually, they don't have proper VR setup. They don't have proper VR surgeons to train them. And maybe that is the reason why, and till now, most of the surgeons in VR are like more males. Females are very less. So we don't get much an exposure to a female VR surgeon. That might be one cause. And then, because you are not getting an exposure during your undergraduate or the postgraduate time, you feel that it's something which is very difficult to go through, learn, and all those things. It's because you are not experiencing it. So once you get a hang of it, I don't think that it is something which is like a very difficult thing to master. So why I chose VR surgery? See, basically Divya was also mentioning it's a passion. So I like these cataract and cornea. I felt that it is a little dry and it is colorless. Retina used to be very colorful. You see that red blood vessels, then that nice color disc, optic disc. So everything was very colorful. And then once you start doing little practice, you know that you can manage to do something little bit of cataract and everything after your post-graduation. But if you have to touch retina and treat, you need to have a special training. So I felt it was a little challenging. So whenever there is a challenge, then you feel like, okay, I should master it. And why someone would choose a specialty, there are some factors like individual and some external factors. Individual is like, once you feel that, okay, this is my passion, then you should look for things like, okay, how can I get it? So as she was mentioning, you should try to get the fellowship done in one of the best places. If that is not possible, try to get maximum utilization of where you are. So I was like very keen that I should get into LV Prasad. I don't know, for some reason when I spoke with people. So even though I got earlier in some other places, I did not join and I waited till I got in there. And so how you develop this interest? As I mentioned, it is either passion, or some people might join because of your need. Need in the sense like, okay, you feel that, okay, if I join this, I might get better job placement, or in my area, this specialty is not there. Or you might be already having a family practice, wherein like I have to take over that. So this depends upon your personal choice and what gives you happiness and what is your interest, because that decides how you move along within your path. And one thing you have to remember, all our dreams can come true if you have the courage to pursue them. And fellowship, as everybody mentioned, it's not an easy thing, especially when you go to the Premier Institute. It's a very tough task. So you have to be mentally prepared to go through this. But you know, I can tell you like it's worth it. But you have to be very patient. You wait and then it will be fruitful. Another factor is mentorship. You should have good mentors. So this Dr. Annie Mathai, she is no more. So she actually taught me via surgery in the beginning by hand holding. And in many places, even in your workplace, your training period, you will have to face so many adversities. But as she was also mentioning, try to make use of the adversities, try to make best use of it. So after I completed my fellowship, I joined the hospital. For 6 months, I could not get an OT space because it was jam-packed. And I was asked to do emergency surgeries after everybody's list. So everybody used to call me like a scavenger. But you know what? I learned maximum to how to manage all the emergencies. I used to operate maximum of 2-3 foreign bodies in a day. So I became an expert in that. And after that, I got an OT half shared with Dr. Ajit Babu. He used to be one of the finest surgeons. So I used to ask his fellow, whenever I see a complicated case, if I can scrub with him. So then I got a chance to learn the best from him. So any adversities, you try to see how you can learn from it. So that is how you improve yourself. And pediatric surgery, again, after I did my VR fellowship, I realized that if you have to manage a pediatric, you need a special training. Even after you complete a VR fellowship, it is not easy to do pediatric. So that I felt it as a challenging thing. So I learned that I decided I should master that too. So that is how I landed up with it. So it is like it's your desire, your passion. And see, when come to training, don't think that all people are like born surgeons. They are not. So there are two aspects to it when you go for a training. One is you master the non-technical skills. That is how you see a patient, how you decide the patient needs a surgery, what will be the outcome, how you communicate with the patient. All these things come in under one category. Next is acquiring the technical skill. That is your surgical skills. So that you learn from your teacher, you learn from your seniors. So there is an initial phase where you first understand the procedure, then you try learning it, doing it, but you are likely to make mistakes. One more important thing is that whenever you are in your training phase, never be overconfident. Suppose your senior entrusts you with something, and if you realize that maybe I might go wrong, don't experiment. Get help. So that is the best way. That helps in two ways. One is you will not lose your confidence. Second thing, your trainer will have more confidence on you and they will entrust more difficult cases with you because he or she knows that they will not do anything wrong. In case if they feel that they cannot do it, they will ask for your help. So this has two advantages. Next is the integrative phase. When the performance become more fluent, means like you are less likely to make mistake. Then many a times many of the cataract surgeons, they don't even think beyond some level. It is at the spinal level. But when you become an expert, if anything goes wrong, it's your presence of mind and the ability to think and decide at that point what should be done. When you have that mind to decide on when you have to tackle the complications or an unexpected event, then you become an expert. So that is how you transform your training to become an expert. And as I mentioned that, so the initial phase will be like you become a competent, and then one thing is that many times in the training or in the fellowship you feel that everybody compares with others. See, he is learning fast, he is getting more, I am not getting cases. It's not like that. See, some has an innate talent to acquire and grasp things faster. It doesn't mean that other surgeons are bad. And I have seen during my when I was a consultant there, trainees who had come with they did not know even how to put an incision. But it's their dedication, their willingness to learn which change things. See, if one can pick up a skill in 1 hour, someone might require a month. But if they are dedicated to do it, in the end, everybody will be the same. So now you understand, it's not like that you are a born surgeon, but you can make. But it's your dedication and will to do that. So advice to aspiring VR surgeon, think why you need it, whether it is your passion or your need, and choose the right place and try to make best use of opportunities, even in your adverse situations. And as you master these skills, the best way to learn and consolidate what you have learned is teach others. So when your juniors come to you, teach others. Because see, in your fellowship or in your training period, it's not possible to make all the mistakes that is possible. But when you assist others, they will make mistakes. then you know that, okay, this is what I should not do. So many of them think that it is a waste of time training others. It's not like that. You learn the most when you do that. And one more thing you have to think that many of them will come and say, one consultant is doing like this, why you are doing like this? It's not like that. In medicine, it is not just only one way of doing things. There are different ways to do it. And different surgeons do it in different way. So if you're in a fellowship, you have the chance to see all these different ways, and you finally decide which way suits you better. So you adopt a way. That is advantage. Another thing, many of the fellows and trainees, I see that they'll come and sit in the surgeon's chair only when their case is being called, and rest of the time they'll be roaming around. Never do that. Observe, observe, observe. Whether it is a co-fellow, consultant, anyone else. Because as I mentioned, you cannot make all the mistakes. Others will do. So learn from them. And observing is the best way to learn. Don't think that it is only when you do. And always be true to yourself. And always remember that patient safety is your priority. And every patient you operate or see, think that he is your relative. That is one way to do the justice. VIA surgery, especially diabetic vitrectomy and all, it is a very humbling surgery. So don't think that if one of your cases became very excellent outcome, never become overjoyed. It will, after few cases, you will see that you will have to be always remain grounded. So thank you. So what I would like to say is that being women is our mindset, and become a surgeon is your passion, or it's your, what I should say, your willingness or your wanting. So there is nothing to hinder if you really want to. Thank you.
Thank you, Divya ma'am. That was an amazing talk. I always considered you as an angel sent to me, because when she left from LVP and she joined Giridhar, exactly like she said, she had held my hands through every complexities. So I really thank you for doing all that and making me here. Thank you, ma'am. And now I invite Dr. Avinash Patanke sir, the Network Director, Academy of Eye Care Education at LVPI. He is the heart of our show. Over to you, sir.
Right. Thank you, D&D, for the opportunity. And when I was thinking about the topic which was given to me, this is not something which is unheard of or unsaid, but what caught my attention was choose wisely. So there's a factor of wisdom involved in it, and that's where I'd like to utilize as much as possible about 27 years of experience which I could bring into this presentation. So flip back 26 years ago, what would have been my presentation if I had to do this? So if I finished my residency, I would have said, okay, do fellowship. Okay, you can start your private practice or into group practice. Those are three things which I would have told and I would curtail myself. But it would have been incomplete if I had to do that today. With 27 years of experience backing me, I can suggest there are 5 career paths one can adopt once you finish your residency. One is being a clinical ophthalmologist. Second is being an academic ophthalmologist. And third is leader in ophthalmology. And fourth, you can offer yourself to work in public health. And fifth is today you can also become an entrepreneur in an industry. So these are the 5 career paths what you can pick up after you finish your residency. It's just not what I just said before, fellowship, a private practice, or in your solo private practice or a group practice. Let's understand each of these in a little bit detail. In terms of academic and being an academic ophthalmologist, yes, fellowship is something which you would like to pursue, especially when you have one particular specialty which you want to specialize in. Then you can get a position of academic ophthalmology in various medical schools or university. You can become a faculty member, balancing the clinical practice, research and teaching there, or you can be a researcher also. So that's an heart and of an academic ophthalmologist position. In terms of clinical ophthalmology, you can make a solo practice, you can join a group practice, you can also enter into hospital-based practice. And in community health, I want to draw your attention, which is an upcoming part, which is known as global ophthalmology, which is where you don't curtail yourself in the place where you are settled, but you have an opportunity to work in different parts of the world, especially when you are trained in 3 different resource settings which are all over the world. That is high resource setting, mid-level resource setting, and low-level resource setting. And then you have teleophthalmology, especially when you have the gender shift, when you have those years or months which is unfavorable for your regular practice. This is where someone wants to get into a teleophthalmology and still be in touch with the profession. Medical teleophthalmology or in education is something which you can still opt for. So these are 5 things in clinical ophthalmology practice. I spoke about academic ophthalmology, I spoke about clinical ophthalmology, and third about leaders in ophthalmology. So where someone aspires themselves to get into a leadership position, especially wants to become a director or a department chair, when they oversee the clinical, the educational and the research activities of the entire organization, that's something which you can try. Or want to get into a medical director's position where they curtail themselves into the clinical practice, and or as a healthcare consultant to healthcare organization, governments and so on and so forth. This is a leadership trait which one can have, but one important skill one should acquire is, if you want to get into this field and have some sort of an authority and educate yourself, pursue an MBA or LLB after your residency in this field. Now, what about public health? You can work in government agencies or in public health ophthalmology, focusing through various public health initiatives. But here, if you want to educate yourself in public health paths, pursue your MPH. That's something which is important. So I struck upon academic ophthalmology, clinical ophthalmology, in leadership. In leadership, it's better you pursue an MBA, or you also have a law degree, or in getting into a public health, you can pursue MPH. And if you want to become an industry or entrepreneurship path, pursue MTech. There are courses. LVP also started a course where there is an union of ophthalmology and also the MTech, which is offered by IIT Hyderabad, where you are in a position to have a startup, or you can have an entrepreneurial skills. If you do have deep in you, you can start exploring those things as well. So that is something which you can think about in those 5 streams, which is very conventional. I'm using the word very conventional as of now. Let me reiterate again: clinical ophthalmology, academic ophthalmology, leadership in ophthalmology, in public health, and then in entrepreneurial part. All of this you can look at. This is something I'm still saying it's very conventional. But if you want to park yourself in a higher orbit in the future, I see these are the things which you can adopt. One is known as precision medicine, or is known as personalized medicine. And other extent is what is known as a planetary medicine, or it's a gamut of One Health. These are the futuristic medicines which are coming in vogue. Then you have the deep learning, machine learning and artificial intelligence, where you entangle yourself with a different specialty and try to gain that sort of a competence and skill required for it. Regenerative medicine and preventive medicine. So I place my bets in all those 3, in these 5 aspects for something if you want to park yourself into higher orbit in the future, but that's a personal choice which you have to make. One thread which stands connected with all these different 5 aspects what I told you, or 5 different fields which you can, is they all interprofessional or transdisciplinary. The future of medicine is going to be a colleague who's going to stand next to you, who's going to be of a different profession altogether. So embrace it. It is just not going to be an ophthalmology colleague standing next to you into your practice. You'll have people with different professions coming in for a very holistic cause. So if you want to get into higher orbit, you can think about precision medicine, planetary medicine, regenerative medicine. Then you have the deep learning in medicine and preventive medicine as well. Now, having spoken about what are the various streams available, and if you have to grace to the crystal ball what is available for in the future, I would like you to take the crossroads. And this crossroad is, if you finish your residency, the crossroads which you want about your fellowship. Every jump you have from 12th to your MBBS, you land up in a crossroad. And sometimes we don't understand why we get into medicine till we go climb the mountain 3/4 and try to understand this is the mountain which I didn't want to climb. It's just because I fell in love with biology, or my grandfather was a doctor, I get into an opportunity to become a doctor, right? It's a very emotional call which they have. And similarly, after you finish MBBS, you want to choose a specialty, it is another emotional reason. So anytime when we have to navigate between 2 crossroads, what we have, it has to have a lot of reverence in terms of being very practical in trying to understand by asking the right questions. So how are we going to navigate this crossroad after you finish your residency into your fellowship? I would say there are 9+1 questions which we have to ask ourselves and try to find answers to it. And when we ask these 9+1 questions, one I wrote for the only reason it's not a question, it's only when we still don't have a certainty, we can still offer or get into an institute to understand more what specialty I want to pick up by becoming an observer. Of the remaining 9, the 3 is very personal. Let me finish the very personal aspect is because your fellowship is going to be anywhere between 1 to 3 years depending upon the type of organization you want to enter into. That would entail, are you ready for travel? Are you ready for relocating? Are you have any family responsibilities which you have not taken care, or you're okay with the additional years of training and increased living costs? These are very personal decisions what you have to make. But what are the professional ones, like choosing which type of specialty you want to enter, or you want to do a comprehensive fellowship, especially when you have a residency which has been incomplete. Second is, am I interested in becoming an academic ophthalmologist? Now here where I would like to pause, and I would like to inform you the difference between clinical ophthalmologist and academic ophthalmologist. Clinical ophthalmologist who does have the clinical and the surgical competence, whereas in academic ophthalmologist is with clinical surgical competence, they also have for education, academics, technology, so on and so forth. There are multiple other feathers which get added on to the hat to become an academic ophthalmologist. So if you want to envision yourself as a leader in one field, again, you can get into a fellowship level. It also gives an opportunity, if you are wide open to understand, that it is going to increase your earning potential and job opportunities, and if you want to increase your competence. It is here where I would like to say, in an era where everybody talks about skills, there is a difference between skill and competence, and skill is very technical, right? If you have a nurse where you tell that IV dextrose has to be administered in this patient, the act of just having the cannula insertion is the skill, but why a dextrose has to be given forms the competence part of it. The brain behind the skill is the competence, the knowledge. So skill plus knowledge in very simplistic forms the competence, and we are here to understand more about competence than skill. So anywhere go where you can get an competence. Having gotten the theoretical competence many times, sometimes you feel that if I just have to have little bit of skill, especially for cataract surgery, to build up a private practice, you can go to a center where there are alternative paths where you can beef up your skills or add up your skills in a shorter period of time. So understand what skill and competence what you want, and then you want an academic ophthalmology position or leadership position, or have a wider responsibility with subspecialty you want to take. Answer these 9 questions, and if over 50% of them is congenial to what your understanding is, go for fellowship. Otherwise, I think there are other options which you have, which you can pursue. And if you still don't have an answer, get an observership position to get more clarity into this. Now, before I have a couple of slides before I conclude, I want to share, I like to address certain issues, and especially if you are a person who has a profession, passion, and a purpose going in tandem, right? Then your entire life will not look at life like a work-life balance. Everything is part of it, right? And one such philosophy, which is known as Ikigai, it is followed by people of Okinawa. It's one of those blue zones what is available in the world. And what they have is 4 circles which intersect, and the center is Ikigai. And those 4 circles, the first one is what you love to do, and then you have what you're good at, and then does the world require one, and last is who pays for it. So there's a financial component also to it. So let me repeat: what you love to do, what you're good at, does the world require one, who pays for it. And if I have to do it myself, when I've done, you have to take a couple of years or even months to understand what I'm good at. I'm very good at in vitreoretinal surgeries. Then I'm good in treating in posterior segment infections. What I love to do is making people better in life. I love to learn. So that is something which I'm just filling up these circles so that it will help you to fill up circle by yourself. Does the world require a person who can teach and make people better, at the same time heal people with vitreoretinal diseases? Certainly yes. And who pays for me? It's my LVP, the working organization, which is going to pay for me, right? So you try to do it yourself, then you will become a person whose profession and purpose are very much aligned and works in tandem. And before I end, I will say this decision which you make has to be made with introspection, and is your own decision, and it's a personal choice. And I would like to say that all of you are unique. You don't have to emulate anyone else 100%. You can observe, you can listen, but since all of you are unique, you're born with your own talent to make a mark in this world. You just don't have to copy or emulate just because that person has done fellowship. I would like to do fellowship. If this person has done something in cataract, I would like to do something in cataract. Understand yourself, understand your personality, and if it is someone who is going to break the walls and try to make something different into the world, then you can opt for something what I just suggested. If not, you want to do something what everybody has done, nothing wrong with it, but whatever you do, do it properly. With this, I end my slides. Thank you very much for your patient listening.
Thank you, Dr. Avinash. Thank you for delivering this talk, and thank you for flying from Visak to here.
Sir, please stay back. Would like to present a memento on behalf of KSOS.
Now I invite Dr. Anubhav Goyal. He is a self-made man in the field of retinopathy of prematurity. To his talk, sir.
Thank you, Divya, for giving me this talk. I was very confused how to make it. So first of all, I'll thank Dr. Divya Balakrishnan to say that best institute make best fellows. I am not fully in favor of this. You are the person who can change your institute in the best institute. Not all institutes are best, but you can make your place the best one to live and to work. So this is what Divya made a flyer for me, inspiring for aspiring specialist, my journey in ROP. So I was totally naive and untrained when I finished my fellowship. And to be very honest, I did just 1 month observership under one of my consultants during my last days of my fellowship. I was not trained at all for ROP, and I've gone for 3 or 4 visits of ROP. And at that time, 2 of my senior consultants leave the hospital. One of was who was seeing the ROP, and another one who was a VR surgeon. So I was basically joined as a VR consultant and was pushed to see ROP with a zero exposure in ROP. They were initially my emotional saviors who helped me maintaining my emotions during the early days of my ROP perseverance. So in 2015, I started this journey. I started as a VR consultant initially with minimal VR surgeries and a huge OPD load. As you are obviously know that initially you have to see more of OPDs and you'll definitely get very minimal surgeries. So I took this opportunity as a challenge and started working hard on it. I was a person who thinks move with the crowd and do things differently. Never go with the crowd, make some mark away from the crowd. You have to do some smart work, not just hard work. So initially I was in very bad stress. I tried to read all whatever maximum information was needed to do ROP, and but the theory is not always sufficient. So I started with one NICU in March 2015 with PVS Hospital in Cochin, and the same day, my first day of ROP, I saw 36 babies on first day, did 3 lasers in ROP in the same night, started at 8 a.m. in the morning and finished at 2:30 a.m. in the night. So that was the day I learned ROP the harder way. I was very badly shocked that day, but then I learned the ROP, and so now from the one NICU, now I've screened 19 NICUs in Cochin, in Kottayam, all around. Started from very small patients, but now your patience, your perseverance, and your consistency can change the way you work and the things you make. So now daytime, basically, initially when I was struggling, a lot of hospitals used to call me, Dr. Anubhav, can you come, whether you can do this, when you can come today itself. So even after OPD, I used to go to the nearby hospitals to do ROP screening and used to give, if needed, laser on the same night, and used to come late in the night. I used to sometimes go alone in my own vehicle also, not accompanied by some driver of the hospital or hospital vehicle also. So initial days or even now, we have to see all type of patient. I have done treatment to patients who are not having even money for even 500 rupees to give for consultation or for laser. I have given laser out of the thing that baby should not lose the vision. We have to, being a professional, we have to take care of the society, and every single person counts in this treatment. So once when I was moving the laser machine with the indirect ophthalmoscope and with my camera in hand, once a neonatologist asked whether I am returning from a Singapore trip, seeing the number of bags I am carrying. So in my starting days, I started ROP with a naive person, was finding difficulty how to put a speculum in a baby also. On the left side, you can see it's very, I was struggling to put. Now I am putting, I'm screening a baby like a master. So after that, the next challenge came, how to counsel parents, how to counsel neonatologists, how to prove that what I am seeing is correct, which is according to the literature, which is equivalent and important and has to be treated immediately or has to be screened. I was not having anything that time. The ROP cameras which were there was very costly. There was no red cam at that time. So luckily in 2016, Dr. Ashish Sharma gave my red cam to Dr. Girdhar as a gift to take photograph for posterior segment imaging. Since it was of limited use, it was lying ideal. I started using in some OPD cases and was taking off and on some images out of my interest. That's all. It was, since we are having fundus camera, so it was not needed for recording, but for patient in OPD, I used to take it. And this camera, I took as a challenge to use an ROP with my own smartphone. This is my smartphone, which I was keeping that time, and tried different lenses to get the more clear images. And with my smartphone itself, I started doing this ROP imaging to counsel parents, to tell the neonatologist that what I'm seeing is correct. You have to trust because this is according to the guidelines, and the images were equivalent to the red cam what most of our institutes are having now. So these are different images you can, I used to get all type of images from minimal staging to advanced staging, and APROP I used to take from my own phone and used to show to parents and neonatologists and used to treat the patients. So this is a case example with pre and post treatment. So this is just to show you that if you don't have this access also in periphery, you make your own ROP camera also just with a small PVC pipe. It's not that impossible thing that if you don't have any access, you cannot make. This is just for documentation sake, because ROP is a thing which you have to document. So the most important part in ROP is counseling parents and informing neonatologists and ICU team to coordinate with them and to keep them in the loop so that you can do the right thing on the right time with the right instrumentation. So this is two type of treatment in medical ROP which you have to do. One is on the left side is how to give laser, and the right side how to give injection and ROP. This nowadays this has to be given in respective NICUs which I am following and training fellows also. So ROP laser is totally different from adult laser what you are doing in your regular OPD or VR practice day-to-day medical retina or surgical retina. It's totally different. You have to take it differently. You have to be perseverance. And you have to understand what is the treatment, then only you can give success to that treatment also. This is a result of a different type of a treatment for different pathology. Since most of our doctors, as we know, we are run away from ROP. Why? Because medico-legal complications are there. Whenever you ask whether you do ROP, no, because I have to move more, I have to go out of the hospital, there are a lot of medico-legal cases are there. And we should not do, because if anything happens, I will be sued. No, it's not like this. Most of the medical cases are because of negligence by a neonatologist or a pediatrician, not against ophthalmologist. That is first point to show. Even though there is the highest cases of 1.8 crores, but still you have a line of hope, because if you see ROP on time, and if you diagnose and if you give treatment, no one can sue you. Only thing, if it may be complete or incomplete. Even if it is incomplete, if you feel that is not complete, you have a standby, you can refer it, you can take an opinion, you can refer it to a better specialist. But if you have diagnosed, if you have started treatment, no one in the world can sue you. So you have to be consistent, do no need to run away, no need to get afraid of the ROP at all. So the major concern of ROP is accurately diagnosing ROP and giving timely treatment, keeping the neonatologist and parents in the loop, convincing the neonatologist, convincing the parents what is the pathology, how severe it is, whether it need immediate treatment, whether you have to, what all necessary arrangements has to be done, fixing a day every week so that no one should mix the screening or treatment part. And there should not be delay in you are reaching the hospital, because delaying and prolonged dilatation of the baby can have systemic complications. So you have to be, as your responsibility, you have to keep with time. And signing NICU with the respective NICU is important to coordinate with the NICUs periodically. Now we have from single person, now we have a whole unit with a mobile van. We have a lot of publication and few chapters in ROP. And now we have approximately screened nearly 2,000 babies or more. This is a photograph which I am showing. I was returning from Kottayam in 2018, 31st December, and this was taken at 12 o'clock when everyone was celebrating New Year. I was finishing my ROP and returning from Kottayam. This is in the Kottayam city. I took this photograph with my driver. Now we have trained a lot of fellows, whether they are coming from medical retina or surgical retina, with a hands-on on laser and injection also. These are few fellows which I am showing you. I have trained them for ROP. Dr. Divya Alex, the coordinator of this course, is also one of our trained fellow which we have gone through. So the family of more trainees are still increasing. This is a very good way of promoting ROP. You have to make posters and we send it to different places and keep it in the ICU so that all can be made aware about the thing. And you have to be very perseverance and consistent. You have to go out to the crowd. You have to present in national, international forums, and so that your thing can be known to everyone, and you have to make a mark in the field. Then only I was meant to be a VR surgeon, but I took this as a special opportunity, which was a medico-legally very difficult thing. No one wants to take it, but I took it, and I was lucky to make a mark in this.
Dr. Anubhav sir.
Yeah,
We'll
finishing. Okay. So it's difficult to achieve this place. I got a special award. These are few images which happy kids are coming to me with the happy parents saying thank. This is one of the note given by one of the parents. If you miss one child, it's a lifelong pain. There are two centers which give professional training with LV Prasad Hyderabad and Arvind Coimbatore. Girdhar is the only institute which give you ROP training with outsourcing in whole Kerala. So it's a passion, not service. I enjoy it as a picnic, not pain. Do smart work, not just hard work. Make work your passion and enjoy life. No one can blame medical legally for ROP if you are timely treating it. Live life Gangnam style. And I thanks to my Dr. Thomas Tachel who introduced me in the field, and Dr. Girdhar who always have high faith in me. Thanks to my parents for helping me in my journey. Thank you.
I thank Dr. Anubhav for the talk. Due to time constraint, we have to just speed it up. I invite Dr. Kartika to the stage. She was my student. Now I am proud to say that she is an entrepreneur in the field of cosmetology. Over to you, Dr. Kartika.
So, it's an honor to be on this stage, and it means a lot to me. Thank you, the entire team, for giving me an opportunity to be on this stage and express my humble views on an uncharted territory in ophthalmology. Welcome to the Hidden Gem. So, where Dr. Avinash sir has stopped. See, for those who don't know me, my name is Dr. Kartika Kiran. I might be the least educated or the least experienced in my generation of ophthalmologists, yet here I am, who struggled to get into MBBS at Government Medical College Thrissur in 2006, then into DNB Ophthalmology at Little Flower Hospital, Angamali in 2013. So, how was me feeling after post-graduation? I was tired and confused with the family matters, marriage, kids, where to settle, and everybody was expecting me to take up the financial responsibilities also. And I got into the precise eye care. Meanwhile, I took medical retina fellowship from Giridhar Eye Hospital also. After investing 8 long years in the practice, was I happy? Was I stressed? No, I was stuck. I was stuck personally and financially, and I wanted to upscale without investing much more time and money because I was already 35. There came my mentor, my warrior, and my ever support, that my husband, who asked me to do something different and something spectacular so that I can be on the stage one day sharing my experience. Thus, we started ClearFit in May 2023, and exactly 1.5 years later, I am on the stage presenting my first ever show. So, ClearFit generated us a fortune which is equivalent to the prize money of a Mercedes-Benz S-Class. That is almost 1.5 crores in a period of 12 months, and we got back all our investment in a period of 5 months. So this is the story of me when I started, and this is how it is going now. See my transformation. So what was ClearFit? Clarifit was never an ophthalmology clinic. It was a cosmetology clinic. And wondering what an ophthalmologist is doing in a cosmetology clinic? Let's rewind back to the OPDs. That is, the skin tags that we are seeing in the margins, the xanthelasma, the under-eye darkness and the hollowness, the crow's feet, under-eye bags, the periorbital wrinkles. As a junior, I have said no, there is no way to all my patients sitting in my OPD. And there comes the role of cosmetic ophthalmology, bringing vision close to beauty. Isn't it done by a dermatologist? Hey, who are you to ask me that? Who knows the anatomy of periorbital area better? Who deals with 6-0 sutures more? Who deals with periocular microsurgeries more? Who deals with the complications of upper face? The filler, any complication happens, all dermats, all plastic surgeons, all maxillofacial surgeons refer to us. And we are expected to know to manage that complication. And who is hitting the retina with lasers? Why can't I hit the periorbicular skin with lasers? So, pursue cosmetic ophthalmology. Enhance the aesthetic appearance around the eyes, upper face, the mid face especially, the surrounding areas with surgical and non-surgical procedures. See how beautifully the under eye has improved for this lady. The brow shapes, the forehead wrinkles, the crow's feet. And this lady can face the society without her insecurities now. So, these are some of my moments. Always find solutions to the problems in our OPD and make it into our own business. I chose aesthetics because I wanted to change. I wanted to expand my ophthalmology horizon, my MBBS skills, my artistic skills, everything, and reach the skies. Our services we offer: Botox, fillers, lips, threads, glutathione, scar reduction, cosmetic camouflage, blepharoplasty, under-eye peel, xanthelasma excision, lasers, PDRN, the regenerative medicine, which Avinash sir has said, and whatnot. We have over 5,000 clients in the past 1.5 years, and of course, 95% of them are happy clients. Otherwise, I wouldn't be in this position now. And it made me rich, and it made me cool also. And my earnings were like... But we didn't stop anywhere. We all created our own empire, that is Dr. Suma Karthika Specialty Eye Care and Cosmetology Center in Ochira. But it was never a single woman show. I needed market research, building on negotiations, investment, company formation, bank accounts, GST registration, negotiation with equipment manufacturers, availability of equipment loans, and finally to the inauguration. And it's my team which helped me with all that, each and everyone having their own roles. My Suma, my husband, and 2 managers, Sijujetan and Vijesh. So, those who are new into entrepreneurship, do anybody know what is SWOT analysis? It is considering our strength, weakness, opportunities, and threats. By the way, talking about the opportunities, do you know central government is supporting us in the form of Beauty and Wellness Sector Skill Council? They call this industry the sunrise industry. And India is showing the exponential growth more than the world itself in this industry nowadays. And the computed annual growth rate is reaching billions by 2028. What COVID taught us? COVID taught us self-care, invest in ourselves, invest in our health.
We will just wind up because of that.
Yeah, invest in ourselves, invest in our health, and invest. Who else will invest in us? So there comes the role of disposable income. And India, especially Kerala, if it say even though it is a moderate earning population, they spend high category. And we can also do reverse business also, convert the clients who are coming for the cosmetology as they are affordable to ophthalmology. Elevate your practice with incorporating aesthetics into, and this opens a window, a heaven of opportunities. And the most common question which is asked to me, where did I study? I went to so many recognized and unrecognized institutions, many dermatologists, many maxillofacial surgeons, and many plastic surgeons. And here I find a problem, that is, it is highly unorganized. And we made it into the business, that is, we are starting our own classes. Welcome to the training institute provided by us for the budding ophthalmologists and ENT surgeons into the aesthetics. And also, those who are empowered and enlightened to become an entrepreneur at their own clinic, we help you in building, marketing analysis, operating plan A to Z from company formation, necessary license and civil work. That is Kiranam Healthcare Private Limited. I cordially invite all of you to visit our centers, Clarifit and Dr. Suma Karthika, or for the inauguration of our 3rd center.
Thank you, Dr. Karthika, for that wonderful talk. Due to time constraint, we have to, but it was really a nice talk. Thank you.